Hi, I'm Nicole Aleskas, licensed massage therapist and owner of TotalBodyHarmony.com. And in this video, I will be showing you deep friction massage for osteoarthritis. Osteoarthritis is considered a degenerative disease. It is the degeneration and eventual loss of the cartilage in between the bones and the joints. There are many different reasons to get osteoarthritis. It could be genetic, it could be an autoimmune trigger, many different reasons for osteoarthritis. Depending on what stage you're in the disease process, it could be chronic and you can have some aching in the joints. It could be acute and be very inflamed and painful to the touch. If it is painful to the touch, you might want to seek a doctor. If you are seeing a massage therapist, they might use some liniments or applications instead of doing the deep friction massage at that time. But if you can sustain the pressure, then by all means massage is indicated. So I will be showing you the deep friction techniques on the spine. I'm not going to directly put pressure on the spine. I'm going to be going around the spine, muscles next to it. So any joint that's affected by osteoarthritis will have aching muscles, tight muscles, maybe some trigger points and adhesions. So friction is the perpendicular motion over a muscle. So the muscles are going this way and I'm going to be going over it. And I'm not going to glide, so I didn't put any oil on it this time. I typically would warm up the area first with some effleurage and petrissage, some Swedish movements, and then I'll go deeper into the friction. So I'm going to go along the spine, not directly on it, right next to it. I'm going to find the dip in between the erector spinae muscles, and then I'm going to slowly move over the muscle belly and find the high point. And I can feel there is some tension in those fibers, so I can either plant my fingers here as a foundation, or I can just rest my knuckles. I'm not putting any pressure on my knuckles here. As long as my thumbs are straight, my shoulders are down, and I'm leaning with my knees. And I'm going to slowly ease into the muscle and I'm just going to friction forward and back. I don't want to stay here for too long and create any swelling or inflammation, so I will move to another area. I can get a little bit in between the spinous processes on the side, and I can move this way in those little muscle fibers. If it's the first time they're getting a massage, it's going to take a while to get deeper into the tissue. So you want to start out with any superficial adhesions you might find along the spine or along affected area. And don't stay in one spot for too long. So I'm going to move along the spine and do the forward and back friction. And the longer I do this, the deeper the tissue lets me go. And I'll go back to another area that I've been there before, and that way the blood has been kind of moved out and circulated. I'll do some effleurage to move the blood and tissue around, let that circulate, and then I'll go back in and do the cross fiber frictioning. And so deep friction comes over time. You don't want to go deep too fast. You want the tissue to speak to you, allow it to ease, have some feedback and communication with the person on the table, or if you are the person, make sure you make the massage therapist aware of what you're feeling and what's going on. And so that is deep friction massage for osteoarthritis. My name is Nicole Aleskas. I'm a licensed massage therapist. If you need any more information on massage or wellness, you can go to www.totalbodyharmony.com. Thanks and be well.